You are an executive director of the European Breast Cancer Coalition. What is the main objective of your organization and what have you achieved so far?
Our coalition today consists of members in 46 countries, many of whom are breast cancer survivors. I myself am a breast cancer survivor. And our main aim is to ensure that women have evidence-based information on breast cancer and, above all, to have access to the best early diagnosis, treatment, and follow-up care for this disease. And we've done a great many projects in order to try to bring this to fruition across all of our European countries. So there's a great deal more awareness today than there was 10 years ago, and a great many more programs that are trying to help women receive the best services. But there is still a lot of inequality amongst the countries. So one of the things that we have worked on is to ensure that there is a description of the services that women ought to receive, that they have a right to, by translating this short guide to the European guidelines into now 15 different countries, because this describes the services that women really should have a right to across all European countries.
What are the main challenges in Europe and what should be done at the level of the governments in order to address these challenges?
Well, I think the biggest challenge is that there are still many inequalities amongst our member countries. There are many countries that do have excellent services, but there are still very many national health systems that do not provide these services automatically to women. And this is where governments, parliamentarians, health ministers can really help to understand more about their own system, the services that are being offered to women, and try to ensure that they really are receiving the best services possible for the treatment and the early detection of this disease. Because we have proven, and there's evidence, that the best outcomes for women take place when they have early diagnosis through population-based mammography screening programs and then treatment in specialist breast units with a multidisciplinary team.